Welcome to Broad Eye, the podcast that explores knowledge gaps in ophthalmology and eye care. Hello, everyone, and welcome to another episode of the Broad Eye podcast. My name is Sean Maloney, and I will be the host of the show today. I'm very excited about my guest today. It is Dr. Evangelina Esposito. She is an ophthalmologist, a researcher, professor of ophthalmology from Argentina, and more importantly, she's an old friend, so I call her Jenny. So Dr. Evangelina or Jenny Esposito, welcome to the show.
Thank you very much, Sean. It's a pleasure to me to be here with you today.
It's my pleasure. It's been a long time that we're due to catch up, and so now I get to have you in the hot seat and ask you all kinds of questions.
Yeah.
It'll be fun. So, but the things we're going to talk about today are areas that I know a little bit about, but the questions I'm going to be diving into are, I'm going to be learning at the same time, which is I'm actually quite excited about. So with that, why don't we dive in? So I wanted to maybe kick off the conversation talking about vision, in vision in infants.
That's great, actually. That's exactly where I wanted to start.
Good. So, yeah, and just to give us, maybe give us a bit of an overview. How does when a baby's born, what do they see? What do they not see? How developed is their visual system? How long does that process take, etc.? Like, there's actually a lot of things I have no clue about here that maybe you can educate me a little.
All right, a pleasure. Let's not go so fast. Let's start defining vision.
Sure.
What is vision? It's a complex function. And it's not only about visual acuity. It's about visual field, color perception, stereopsis, and contrast. All right? What is a stereopsis? Is the capability to see in 3D, right? The environment that you have around you is a 3D environment. So in order to do that, you need both eyes. It's so complicated that you also need your brain. You have to have a healthy brain to process that information. And after that, you can say, okay, I'm seeing, okay? It's really, really complex. So if you start in the womb, at the 4th week of gestational age, you start to have the first eye, right? It's like a really undeveloped eye, but it's the start of the eye. After the eye is formed, around the 4th month, they can perceive light, right? So inside the womb, you're already seeing light through the skin of your mother. Then when you're born, you have light defense. And it's a lot of light for a baby who has seen just a bit of light every day. So it's a huge thing. And all the cells that are in your eyes starts to work in an organic manner, so you can have your vision. Then you can barely see at 40 centimeters, not very clearly, and it's difficult to a baby to detect colors because they don't know them yet, right? So they have to process that information. But this is enough to see near faces while you're feeding, so it's what they need. You will see that the eyes of the baby are moving all the time, like probably they're seeing in one way and then the eye is just droopy or change the alignment. And this is completely normal until you get 3 months of age. After you are 4 months, the eyes should behave properly and they shouldn't squint or deviate in any way. The eyes should be straight and they have to fix an object and follow it through the visual field. This is normal for a 4-month-old. So now you can have and you can talk about visual development and brain development. This is so complicated that your brain has to fix the object and adjust your sight. When you reach 2 years old, you have the eye of an adult. Like the size of the eye is almost the adult size and shape. So you will say, okay, maybe we can stop here. This is it. Not really. Vision keeps evolving, and you can have a lot of visual problems that avoid the development of a good sight. For example, if you close one eye of the baby, maybe 2 months old, maybe he has a droopy eyelid and this obscures the pupil, then that eye can not develop well because you stop the stimuli that starts all the function of vision, all right? This is called amblyopia. I don't know if you heard about it.
Yeah, definitely heard about amblyopia, but I'll let
All
you
right.
continue going on here. But I'm actually, I wish I was taking notes along here. There's no test at the end of this, but I'm already learning things. So continue. Go ahead.
All right, that's a complex concept because it states that you need to have stimuli to have vision. All right. So in any time of development, if you stop the stimuli, you stop the development of vision. This is a really important concept because if you have one eye who has a problem like myopia and you don't correct the vision of that eye, you will end with an amblyopic eye, and it's an eye that has the potential to see because it's normal in shape, but it is not developed to see. Like the brain stops the recognition of vision of images from that eye and blocks it because it's not right. Like the image that it's perceiving is not the right one. So the brain just blocks it. And this is really important because it's preventable, okay? If you have luck and you have emmetropic eyes and your eyesight is normal until you reach 8 years old, your eyesight are fully developed, right? And you reach the age of 8 without glasses and with great vision, you are, let's say, normal. And after 8 years, the brain doesn't do that anymore. Like if you have a refraction problem, it's okay. You will wear glasses and it will be corrected. So this is really important to have in mind for babies and kids until 8 years of life. Because after that time, if you have an amblyopic eye for any reason, if you didn't work with it before 8 years old, it's really hard and almost impossible to rehab that. Like you don't have the proper means to fix that, not even with surgery. It's an stimuli-based approach. So you really need a professional here. And when you reach 40, and let's say that you never needed glasses, you start pushing them off you to see it better. This is really important when you reach 40 because if you keep efforting and keep pushing your eyes to read without glasses, you will start with a headache.
No, keep going. This is it's good. You're kind of giving the whole evolution here. But I was just gonna say, I'm almost 40, but my eyes are already in rough shape anyway. So presbyopia would be the least
of
my concerns.
Special condition. It's okay, but keep in mind that even if you haven't had a normal eye during your childhood, when you grow old, you can need glasses because vision keeps changing, right? The condition of the eye keeps changing, and that's why you always have to have your eyes checked completely. Because maybe, all right, your eyes are not the best, but with the pair of glasses, you can see better. So that's always a thing to keep in mind, all right? And when you reach 60, you can have a condition that is called cataract, all right? Around 60 years old it starts. And this often produces myopization of the eye. So probably you will start reading again without glasses. And that's completely normal. Sometimes it doesn't last because the cataract just evolves and you get like loss of vision secondary to the cataract. But those are the refractory changes and the refraction changes that the eye can have normally in life. Now, after we talk about this, we have to talk about vision and problems in vision that can be avoided or prevented and problems that can't.
But wait, before we go into that, I have like
All
14. I have like 14 questions for you here, London. So,
All right.
no, it's interesting. You kind of give a nice overview there of that visual development from basically when you're before you're born right through to when you're older, which is good. And then we can touch on some of the areas. But just some questions come up. Maybe you have the answers, maybe you don't, but they're just some food for thought. When you're talking about how the development of vision is very, stimulus based, and that early on you need that those stimuli to have proper development of vision. Otherwise, you risk never developing those pathways properly. And then you alluded to the fact that in the womb, a baby at a certain age can start to detect light through the mother's skin. The first thing that comes to mind is, are there any developmental consequences related to too much or too little light exposure in the womb?
Well, that's an interesting question. It has been studied. No results, no bad results yet. Like, let's say that it's not proven that either too much light or too few light would be detrimental for eye development. Nevertheless, it's always a thing that we kept thinking about, because if you think about the retina, that is a really complex structure and it's really metabolically active. If you give more job to do in a developing retina, maybe there are things that we don't know yet that they're happening inside the eye that could have a consequence for the baby after. So it's a really interesting question, and we researchers also keep questioning this because we are still too early in the study of the embryo development, all right? There's a thing that we know how it is, but we are not there yet. It's the same as the brain. We are not there yet.
Yeah, no, it makes sense. But early on, okay, just going back to the first few months or years after after child's born. Well, let's think about the first few months or first year. The exposure to certain visual stimuli is necessary for that, again, development of those visual pathways and the eye and vision in general. Is there any thoughts around that, or recommendations or research that a child needs to be exposed to objects that are near as well as objects that are far, like looking at the horizon, looking outside, all these things? Like, I know that as they kids get older, if they're very focused on objects in front of their face all the time, whether it be books or iPads or whatever.
Let's talk about screens. Yes, I love this question.
my kids are going to get so mad at you, but no. But whether it's screens, books, whatever it may be, when you're focused on something close, you're more at risk for developing myopia. But wondering.
Yes, that's been well documented. Like, if you are working near, even if you're older, you will start stimulating your eye to become myopic. Like, it's really proved, especially in people from Asia. It's really well studied, and it's expected that our population will keep growing the myopic people, because we are every time more, let's say, more acquainted to screens, more comfortable with screens. Our lives go through screens, especially in pandemic times. So this is really hard to avoid. But the only thing that it's proven that is good is to have outside time. So I would advise that you have to really analyze the situation of every family, all right? Because if you have a kid with special needs, it might be not the same for you, all right? For example, if your kid can go and play outside, I would say, yeah, please do it. 1 hour, look far, just relax your mind and work outside and exercise and work out. Because the main problem with the screens and near work is that you are too focused on that. So probably you will not do the breaks, like the American Academy of Ophthalmology advises that every 20 minutes that you are in front of the screen, you can take 20 seconds to see through 20 meters away. Like you have to look 20 meters away, 20 seconds, every 20 minutes that you're in front of the screen.
But even as adults, we don't do that, right? We tell our kids, you need to go outside and play. And then you realize you've been sitting in front of your computer for the last 4 hours and drinking 4 cups of coffee and you haven't looked anywhere else, right?
Exactly.
It's like, don't do what I do. Do what I tell you to do.
Of course, that's the thing. Yeah.
And your eyes are still developing. Mine are developed, right?
You forget about blinking, okay? Blinking is a reflex, but when you're in the screen, the reflex is just normally decreased because you're aware of the screen. So you keep like, okay, my eyes are greedy, my eyes are red, I have to blink a lot, like I have tears in my eyes or they're burning. And this is because of dry eye. Dry eye is like really normal now. Everyone, even 20 years old, had dry eye, even less also, like at 18 years old or maybe 14 years old, they have dry eye, and it's a problem because you need the tears. Or remember how to blink, right? But this sounds silly, but it's really important. You have to blink.
Yeah, no, for sure. And we actually put an episode out about dry eye with an optometrist, Dr. Stephen McIntosh, earlier in the podcast.
Yeah,
and whoever's listening to this, they can certainly listen to that for some info. I was hoping to maybe just go back to or the idea of, okay, so you've got kids. We understand a little bit about exposure to stimuli for proper eye development. The idea that probably varied stimuli and varied distances for facilitating that proper development of vision in general. As a parent, what should you do? For let's say a young kids, let's say under the age of 4 years old, sometime from birth to 4 years old. What are the kind of things that you should be aware of as a parent that could ultimately be important for your kid's vision? So for example, you mentioned, okay, if someone has a drooping eyelid that's covering
that's a thing that has to call your attention, because it needs special medical attention as soon as you can get it. Also, if you have probably an infection of the orbit that's called a cellulitis, you can have a droopy eyelid because of that, but that's temporary, so it doesn't menaces your vision, okay? But in a baby that has, for example, ptosis, that is the eyelid that goes down, that needs medical attention, especially if it blocks the pupil. The pupil is the black hole inside of the eye between the colored part of the eye that is called iris. So if you have a blockage in any sense of that hole, you have to go to an ophthalmologist, because that can be threatening to your eyes. So if you are a mother, for example, and you see that your baby is, for example, tearing all the time, this is probably normal, and the ophthalmologist would say, okay, let's wait until he has 1 year old and we can just examine him there. but probably can be another thing. For example, a retinoblastoma, that is a tumor inside the eye. So if you have tearing, if you have a red eye in a child, even if you think that it's maybe a conjunctivitis, if it doesn't soothe with drops, or if it keeps coming back and coming back, you have to be aware it could be something dangerous to the baby. So take him to the health provider. That would be the best option. Also, for example, if you have a child that is squinting, it has a headache and it's complaining about that, that's not normal. You should take him to the hospital. Also, if he had a head positioning, for example, he always looked the television from the side. That's not normal. He can be just having strabismus, that is an eye that is not aligned. So you should also take him to the ophthalmologist. And also, if he keeps closing one eye to see things from near or from far, of course, if he says that he's having double vision, but that doesn't happen very, very often in kids, because as I said before, they just block the image and they keep through because they don't know anything different. So they would never complain. Kids don't complain. Kids adapt. That's why you have to be very attentive and very awake to see this, and just take him to the ophthalmologist. And the last thing that is really important to check, if you take photographs of your children's and you see that one eye is different from the other in the picture, we call this red reflex. When you have a picture with flash and you see the red eyes, probably most of the phones are fixing it automatically, but sometimes you can see a difference between one eye and the other, and this is not normal. That's called leukochoria, and that's a huge red flag, because it could be from a congenital cataract, from a retinal detachment, from a retinoblastoma, that is a tumor from the eye. So this is really important. There are also some apps in the stores, you can have for checking leukochoria or for checking the alignment of the eyes. And this will be interesting also. There are a lot of tools that are developing now in the technology side, because there are some platforms that allow you to check vision if you were in the office, if you were in your appointment. You can have even the optotypes, the letters, and you can check. So that's really cool.
So it's interesting. You pointed out a lot of things actually, but and you know what? A number of them can be initially assessed either using technology, like you said. There's some apps that probably exist out there for this purpose, but even with the rise of telemedicine, I'm sure that maybe not everything, but a lot of these initial signs that you might notice in your child, a drooping eyelid, or they're looking off to the side, or the eyes not aligned, or whatever it may be. I think a lot of this can probably be observed by a professional, even through telemedicine. Is that something that people are doing now in general that you're aware of?
Well, just to point it out, we as ophthalmologists, we're having a lot of trouble to perform telemedicine because of that. You have two eyes. It's really hard to assess your vision at home. So if I ask you now, all right, how is your vision now? You'll probably say, okay, I feel it like before, but you don't have an objective way to measure. And if you can develop the apps, that would be a great tool for us. Another thing is smartphone cams and devices that are being developed that allows you to take a picture of your retina and a picture of your anterior segment of the eye. So this is a high definition picture that I can enlarge, and it's always in focus. So for me as a specialist, is it's great because I would have like an objective manner to see your eye. Because now we rely a lot in technology. We need special tools and special equipment to assess your eye. Probably, I don't know, but you can heard about a retinography or an OCT. So these are complex tools that are being developed in a smallest fashion. And well, now we are in the portable side, like they are portable now. But I think one of the goals is to make like an office that you can go inside and you test yourself, your vision. And it tells you if you need to seek medical attention or not. That would be cool. Like it's like an automated office that it just checks your eyes and tell you, okay, you don't need anything else, or okay, you have to go to the ophthalmologist. It's
Well,
great.
no, I mean, when you think about it, people go to the pharmacy and sit down and they take their blood pressure and stuff like that. So you can imagine if there was something in those types of places that people would, visit often, that they could do that. It'd be certainly interesting. I was hoping to dive into a different topic a little bit. So,
all right.
I know that you have done a fair bit of research and have clinical experience related to a condition that does affect infants, and that is retinopathy of prematurity. So I was hoping that maybe you could explain for the audience and for me what exactly is retinopathy of prematurity, and then maybe we can dive into a bit of a discussion about what causes it, who's at risk for it, etc.
All right. Retinopathy of prematurity, it's when vessels fail to grow normally and start to misbehave and pull the retina, causing a retinal detachment. This will be like the easiest way to describe it. Actually, when you are being born early, you are still developing outside the womb. That's why you need like the NCU care. When you're in a critical care unit, you need oxygen because your lungs are also developing. So retinopathy is really related to use of oxygen. The kids that are under oxygen therapy, they have a higher risk to have it. And also, as more preemie baby, more risk of having a severe retinopathy of prematurity. Retinopathy of prematurity has 5 stages, or at least it's classified like that. The first one and the second one are only followed by the ophthalmologist until it resolves. If it don't resolve, it's the third stage, and that needs to be treated in the short term. You need either laser therapy or anti-angiogenic drugs inside the eye of the baby. And that's
sorry, are those like the same?
Injected.
Those are basically the same drugs you're injecting into people with, wet macular degeneration. You're using like
exactly.
Avastin
Yes.
or Eylea or something like this. Yeah, but
Yes.
do you do actually an intravitreal injection the same way in an infant?
Just a little bit less, the half of doses, and really near to the limbus of the eye, because they have a really small eye, so you really have to be very careful when you're injecting in that special place. But yes, it's the same drug.
Okay.
So when you start, you have these vessels that are growing anyway, and for treat them, you have to just apply that drug, and that helps to calm those vessels and make them go back.
So it's very interesting that the some of the pathophysiology seems to be similar in the retinopathy of prematurity and in the
Wet
neovascular or wet AMD. Yeah, it's interesting in that the same drug can be used, and I can imagine that if you're trying to do an injection in the eye of a premature baby, it's got to be extremely difficult. I had my oldest son, who's extremely healthy right now. was born 11 weeks premature. And I can remember just how small everything was. His eyes, like it's phenomenal. And how small a preemie's eyes can be and how delicate. Now, what's the, expectation of the prognosis for, these premature babies, for example, that have retinopathy of prematurity? I guess what's the range of prognoses? Do most of them tend to, everything is fine because of the state-of-the-art care that we have now, or does it depend on, where they are in the access to care that they have, or do most of them end up with, lifelong consequences? I'm just curious on that.
All right. First, the early detection of the retinopathy is key. If you get a retinopathy in stage 1 or 2, probably your ophthalmologist is going to follow the baby the next weeks. And if everything goes okay, he would have a normal development, probably can need glasses because of the prematurity-related myopia, but nothing else. It's okay. Then if he detects a severe retinopathy of prematurity, he would offer treatment. The treatment has to be really fast because after you make the diagnosis, you are usually need to have the treatment in the next 72 hours. So this is really important. And then when you have it, you can have myopia post treatment. Usually this is with the laser treatment because there are big extensions of the retina that are just lasered, and this would make the eye goes bigger than it should. And then if you have anti-angiogenic drugs, you will need to be followed all your life, but probably really closely in the first 3 months after the injection. And if you have both, well, you will have to be really closely followed, and you are probably need glasses when you reach scholar age or before. But usually the prognosis when the treatment it's doing in a timely fashion, it's great. It's a great prognosis, and the eye gets to be like in a good shape and functioning really well. Then if you have the late stages, probably you might need surgery, and that's a bit complicated when you have a stage 4 and especially stage 5, because those are scar tissues, and it's really hard to put the retina working again. So that would be really closely followed again, because another complications can arise, but especially they would need a great visual stimulation program.
Obviously, you want to avoid the later stages of this disease or any disease or condition. Are you seeing this when we talk about retinopathy of prematurity? Is this only happening in babies that are premature, or can it happen in just newborn infants in general who are full term?
Retinopathy of prematurity, it's a disease of the premature baby, luckily. More premature, more the risk. Okay, but for newborns, there are another diseases that can behave as a retinopathy of prematurity that might arise. They tend to be familiar, and they tend to be asymmetrical. So there is not very common, but it might happen. So you have to be attentive to your kid, especially if you notice some of the red flags that we talked about earlier, because you might need a good diagnosis there.
No, I think that makes a lot of sense. Why did you get into this area? If you don't mind me asking, why retinopathy of prematurity?
Well, I am attracted to vessels. New vessels are extremely interesting because, as you said before, they are a common feature in the wet AMD, then in the diabetic retinopathy, then they appear again in, for example, in retinal vein occlusion. So new vessels in the eye are really not well tolerated by the eye, and they are a common feature of a lot of ischemic situations of the eye. So ischemia is one of the oldest noxes that we can have in the body, and our cells respond really differently to ischemia, and it's a really interesting path. That's why I just feel so attracted to these new vessels, and the pathophysiology of the disease is really interesting. And well, retinopathy of prematurity is interesting to me also because it's a really vulnerable population. So I think that the more we understand this, the potential for those babies, it's really important, because I don't mean to be rude, but if you have a wet AMD, you're talking about a person who has lived his life in a manner, and it's a blinding disease. It's annoying, but they don't lose visual field. Like they keep some things. In prematures, first we are just stopping the normal development with the retinopathy. If you keep in mind that in stage 5 you have the whole retina detached, and that our brain needs the stimuli to keep seeing, let's imagine that in a few years we just avoid the detachment. So if I have a 15 years old that had a retinopathy of prematurity and had a lack of stimuli, even if I'm capable of reattach his retina, he would not see, because the problem is in the pathway. So that's why I find it really interesting to work in the early development of the eye.
Yeah, so it just makes me think of some other questions, and we're going to wrap up soon here because I don't want to take all your time today, but I have a couple of follow-up questions. When we talk retinopathy of prematurity, do you know offhand if babies who are, have retinopathy of prematurity are also more at risk for other systemic diseases related to, new blood vessel formation or other ocular conditions, like wet AMD when they're older?
Well, that would be great to know. Unfortunately, we don't have multicentric studies with that long term of follow-up.
Yeah, that makes sense. I suppose
So
you're talking 60, 80 years
it's complex of study, yeah. We have followed in our center, we have 15 years old, 12 years old, like there are a few kids that we are following, but it's only one center. And so we haven't found yet another new vessel formation issues in this population. But to be sure, we need a deep study of the field and a long-term study, and we don't have that yet.
No, that makes sense. But when you're saying that, excuse me, you're attracted to, neo vessels in general, that area, it's a domain that has such broad impacts in vision, but also outside of vision, right? So, the idea of new blood vessel formation, whether it's related to ischemic events in the body, whether it's related to tumor formation, exactly, in oncology. There's this is where we got Avastin from, right? Was from oncology, and then started using it in the eye, and then developing it from there in other therapies as well. So understanding something that works in the eye in some of these conditions could have broad impacts in other domains, and and vice versa. So, and like when I was doing research, I was involved in some of this type of research as well, and found it endlessly fascinating and endlessly confusing. So, but there's certainly been some progress since that time. But listen, Jenny, I don't want to take all of your time, but I do want to thank you for taking the time to chat with me today. I think we've covered some good topics for the audience. We've done a dive into retinopathy of prematurity and what it is and what to expect, and some of the ways that we can, or a physician, not we, maybe you're a physician, the way you can handle it or deal with it and help patients. And then the red flags that we talk about for parents to look out for during visual development or as their kids are young. I think it's not information you find in too many places. So I think that people listening to this are going to certainly take that away. And I've certainly learned a few things as well. So I appreciate you taking the time to share your knowledge with me and with the audience today.
It's a pleasure for me. I want to thank you again for the invitation and for the audience to be hearing this.
Yeah, excellent. Thanks so much. Have a nice day.
You too. Bye.
And that concludes today's episode of the Broad Eye Podcast. If you enjoyed this episode, please be sure to subscribe on your favorite podcast platform. Of course, ratings and reviews are always welcome. And you can certainly share this episode with any of your colleagues or friends who might enjoy it. Thanks for listening.